Well, great news coming out of the U.S. Capitol building today. It turns out that bipartisan senators Lamar Alexander and Patty Murray have come to an agreement to restore parts of the Affordable Care Act, or more commonly known as Obamacare. And that's a huge move because this was seen as largely impossible under the Trump presidency, considering the Republicans have been hell bent on repealing major aspects of the ACA for the past 10-ish months. So it's a great development. It's something that really brings people from both sides of the aisle together, and it's great. Now we're gonna go into a bit of the details in what they did, because what they did, if you go into the details, it's not really that significant in terms of how much they actually changed the provisions in the Affordable Care Act. Um, but they definitely did. The main theme of basically the deal that Lamar Alexander and Patty Murray reached was to restore the aspects of the ACA that basically gave more states rights when it came to the implementation of Obamacare. It made it more easy for states to be flexible in terms of how they should implement Obamacare and what kind of provisions are present in each state's Obamacare policies. Now, the first thing that they did was restore the over $100 million in funding for Obamacare outreach, which is really crucial considering the Trump administration had completely slashed support for it. In for 2018 open enrollment. I'm reading this off of CNN. I'll link this article below as soon as possible. So basically, this move comes in stark contrast to what the Republicans as well as the Trump administration has been trying to do since he became president. They try to slash enough support to kind of make the Obamacare markets collapse on itself before 2018 open enrollment, which begins November 1st, in fact. So the $100 million funding for the outreach will end up has the intention of insuring more people and not knocking people off their Obamacare plans. Now, the second thing that they did, and this is the main thing, this is the reason why bipartisan consensus was achieved on this legislation, basically. So it made it easier for states to obtain waivers to customize Obamacare rules to their needs, end quote from CNN. And basically, states, they've complained that attaining these waivers was very, very difficult. It's a long and complicated process, which it is because there's a lot of provisions in Obamacare that may not be applicable to all states. But the deal between Murray and Alexander made it easier for states to more easily customize waivers and request certain amounts of federal funding as long as it didn't go over a cap from the federal government, the cap that Trump still has control of. It doesn't loosen any of Obamacare's regulations, which has been a key goal of the Trump administration and the Republicans for the past couple months as well. So it is a deal that favors the Democrats a little bit more than the Republicans, but the Republicans have already kind of been on the side tipped against them on the playing field. It's not level in terms of who has more political support in the Capitol when it comes to healthcare. So the Republicans are on the back foot. They've been on the back foot since Obamacare was first enacted, in fact. And this levels the playing field a bit more because it shows the bipartisanship from both sides. And it shows the bipartisan effort to try and reform Obamacare as much as possible without trying to kind of restructure the Obamacare market, which would be catastrophic and knock almost 20 million people off of health insurance within the next 10 years, according to the Congressional Budget Office. So these waivers will basically ensure all Obamacare enrollees have lower premiums but higher deductibles within the next enrollment cycle. But these copper policies, these policies that basically offer more deductions on their healthcare payments as well as co-pays, apply to people under the age of 30 in order to sufficiently supply healthcare to people who need it under the age of 30, which is a lot of the workforce in this country. And I think they made this provision in order to, I believe, target millennials in trying to get this legislation passed, because before what the Republicans tried to do is give heavier tax cuts to people above the age of 60 and give more tax credits to people who are much older than the age demographic, the median age demographic of this country. So by appealing to the younger people, they're incentivizing them to, I believe, more closely be aligned with the Democratic Party platform, because it really heavily favors them, this bill. So by the end of the day, the Republicans and Democrats have a lot to be proud of in this effort, because this is the first bipartisan piece of legislation. Even though it's more of a revisionary provision than anything, it's really something to be proud of if you're a part of Congress, no matter what side you're on. I feel like it more heavily favors the Democrats, because it just tips the scales more towards the Democrats in terms of diplomacy, and it revises some of the flawed policies of more centralization of healthcare, more of a single-payer system of healthcare to the national government, and spreads it out to the states, allowing them to regulate the insurance companies as they see fit. So this is a really good development, and Trump has obviously taken credit for it as soon as possible. But other than that, it's a fantastic development, and I sincerely hope that it continues. I sincerely hope it passes through both chambers of Congress, and Trump signs it in probably seems like it'll happen if it passes both chambers of Congress, considering as soon as it came out, Trump endorsed this. So that is it for this short, great piece of news, great optimistic piece of news coming out of the Capitol building. And thank you so much, ladies and gentlemen.